give to reduce criminal recidivism. So first one is tailored programs. Tailored programs can be given to the juvenile, non-violent offenders, individual, especially you need to identify the risk groups who are prone to this recidivism. So mostly the juvenile group. Okay, next, non-violent offenders and individuals who are suffering with some mental issues should be given more importance. That will be one concern. Next is intervention activities or programs to be conducted in the correctional sessions, in the form of correctional sessions. And next is integration of technology. Some various technologies have come up nowadays. वो technology use करके उनको counseling therapies भी दे सकता है. And there are some mobile applications and online platforms where they can have this support. So those things that organization can provide. Next is community involvement. Community भी already हमने काफी देर से discuss कर रहे हैं कि community is also very very important, because community acceptance है तभी कोई भी इंसान दोबारा normal life अपने life को lead कर सकता है. So community involvement is also very very important. Next is policy reforms. There must be some policy reforms that to be taken out for effective interventional or rehabilitation programs, because we have seen in some conditions there will be no effective rehabilitation therapies that will be provided to the prisoners. So hence good and need-based rehabilitation programs to be given. Next is collaborative partnerships. They need to have the prison should have some collaborations with some NGOs or some other academic institutions and community-based organizations, so that it will be helpful for everyone to get integrated. Next is public awareness and education. Public को भी awareness होना चाहिए कि इनके साथ गलती हो गया है, उसके लिए वो already sentence होके बाहर आया है, उनको एक again we should not see him as a criminal. Anyways, one eye तो उनके ऊपर होंगे कि वो दोबारा वो किस रास्ते में जा रहे हैं, but हमेशा उनको ऐसा नहीं देख सकता है कि वो criminal ही है. क्या पता, if already he has changed his behavior, we should accept him as one among our community or family. That is public awareness and education. Next, role of healthcare professionals. I have already told you. Healthcare team where the nurses plays a crucial role in providing care to the patient physically, mentally and all other aspects. Even she or he can take the decision making, even in planning the care to the patient. The continuum of care should be there throughout the time of stay. Next. So coming to the summary, I am going to end up my topic. So what we have studied today, is there any relationship exists between the stress management and criminal recidivism? Yes or no? है या नहीं? If हम अच्छे से stress management करेंगे, तो इनका rate हम कम कर सकता है या ज़्यादा बढ़ सकता है? कम कर सकता है, right? So stress management plays a crucial role in reducing the rate of criminal recidivism. Clear? Okay, that's all. I'm going to end this topic for today. So if you have any doubt, you can ask. Otherwise, thank you once again. Thank you, sir, and thank you all of you.
Thank you, ma'am. Thank you so much for this wonderful motivational speech. Students, please make a silence. I know you people are exhausted. So, before moving to the next session, चलें next session पे चलें? हाँ, बस last session है हमारा. अच्छा ठीक है, नेक्स्ट सेशन में चलने से पहले कुछ लाइनें सुनेंगे आप? नहीं सुनेंगे? सुन लीजिए. अच्छा प्लीज शांत हो जाइए. I'll request you, we have a maximum half an hour of session. ठीक है, नेक्स्ट सेशन मूव करने से पहले कुछ लाइनें सुन लेते हैं. ठीक है? सपने उनके सच होते हैं, सुन रहे हैं ना? सपने उनके सच होते हैं जिनके सपने में जान होती है, ठीक है? पंखों में कुछ नहीं होता, हौसलों में उड़ान होती है। So now we will move toward the next session. This is the last session. I'll request you please keep a silence for maximum half an hour. Okay? So the part of the next session is Dr. Lizzie Joseph ma'am. She is a professor and HOD Department of Community Health Nursing from Narayana Nursing College, Gopal Narayan Singh University, Sasaram. She is having total 21 years of experience as a professor and HOD of Department of Community Health Nursing and Department of Nursing Research. Please listen student, आपको भी तो एक दिन यहाँ पहुँचना है ना, तो सुनना तो पड़ेगा ही. Of course, I don't know they came from where and where, but they came to motivate you people, and you also came to listen this session. So please cooperate for only half an hour. She published various research work and professional activities. She is having some patent publication such as patent on artificial intelligence based approach to predict the factor responsible for causing postpartum depression in women. Next patent on implementation of technique for optimization of nurses impact on congenital heart disease patients. She is having membership of Trained Nurses Association of India and also the Member Society of Community Health Nurses of India. Next member of Society for Nursing Practices. Here it's not end, she is having more achievements. Next, she is involved in various committees such as the member of Secretary of Nursing Research and Monitoring Committee in GNSU, member of Institute Grievance Readdressal Committee. She is a member of Institutional Ethical Committee, that is GNSU. Next, she is an editorial board membership. That is International Journal of Geriatric Nursing, International Journal of Community Health Nursing, and Applied Research, Innovative Technologies and Journals. These all are the achievement of Dr. Lizzie Joseph ma'am. So I would like to invite the ma'am for your speech.
Yeah. So, good evening to one and all. I'd like to thank our chairman sir, trustee, madam, principal, vice principal, organizing team members, faculties, and my dear students. So, thank you for the opportunity for calling me here to stand in front of you as a resource person. And Jijal sir has given me a great task to stand here as a last speaker, which is very, very difficult task, because I understand that all students are now ready to run away from here. Yes, you have lost all your patience sitting from here from morning. I do understand. Another problem is almost all my content has been covered by the previous resource person. So it is going to make it simple. So sir has instructed me to share my experience, because I have been working as a nurse in intensive care unit of Apollo hospitals for 6 years. So I know the difficulty of being a nurse, and for the past 17 years I am in the teaching field. Okay, so I'd like to, with not much introduction, I'll move on to the topic. So from morning we have discussed about what is stress. So stress is often termed as a 12th century syndrome. Yes, earlier days our grandparents, they were all leading a slow-paced life. Yeah, what should I do? Can I continue? Yeah, I will try to make it as short as possible to make you happy, right? Okay, so this is what our olden days, our grandparents and all, they did not experience so much of stress. Yes, but today we are in a fast moving world. We have to run. If you don't run, so like man is in a race. Yes or no? We can't see nowadays anyone slowly walking. Everyone wants to move from one point to the other. Yes, so now you are with GNM, you want to move to post-basic program. You post-basic, are you happy? You want to take up MSc. After MSc, you are happy, you want to enroll into PhD. And now our study doesn't even stop with PhD. We have to go for post-doctoral fellowship. I don't know what else will follow. Yes, so we are all in a race. So when the entire community is in race, so nurses are also in race. Okay, so we also have to catch up with the need of our population, right? Okay, so how many hands do nurses need? 2 hands are enough? Sometimes even 10 hands if we have, it is not enough. Okay, so to that much of workload we are having, right? So I know that if you have worked in the ward, when you have taken up internship, you will know how much task you have to complete during your 8-hour shift. Okay, you cannot miss anything. You have to complete everything because it is vital. Okay, nursing in our profession, there is no term telling that it can be done, it can be left. Everything we need in the patient care, whatever we do is vital. We cannot omit anything. Okay, so we are stressed because of that. And causes of stress, already they have discussed. There are some internal causes of stress and external causes. Internal are what we create within ourselves. Okay, external is from our environment, right? And so my topic given here is workplace stress. So various researches has been done and they have identified that majority of the stress, 39% they have identified it is because of the heavy workload. Yes, so Indian Nursing Council, all associations have given some workload, but we are always exceeding that. Okay, so if we are actually taking care of the prescribed number of patients, our stress will be less. But most of the time, most of the institutions, we are made to take care of more. If 10 is your target, they make you take care of 20 patients. So that is where our workload is one of the reasons. The second major cause is interpersonal issues within nursing, outside nursing. Okay, so we have lots of adjustmental problems with our colleagues. So that is another problem. Next is work-life balance. So as nurses, we have to take care of our family as well as our job. And as you all know, we are working 24 hours. So we have to take up shifts. Yes, we have kids at home, so we have to balance that. So most of the nurses, they told that they have stress in maintaining this balance between the work and the day-to-day activities at home. And then 6% they have reported that it is because of job security. They feel that our job is not secured. If I am not doing things properly, I can be thrown out of my job. So I have to prove myself that I am doing the work properly. So if you don't prove yourself, there are chances for job insecurity, right? And next is other 5% is relating to various other factors. And these are all some of the causes. Like career concern is there, role ambiguity, you don't know what is your role. Yes, so if the patient does not get food on right time, who is blamed? Are we responsible for providing food for our patient? It is actually the nutrition department, right? But if food doesn't come on time, we are blamed. So there is no specific area, whatever goes on with the patient, it is directly linked with our nursing role. So our role is not clear. So that is another reason. And then rotating work shift, again it will cause lots of problem. Your sleep pattern gets disturbed. Yes, morning shift, afternoon shift, then when you go for night, next after that when you go and sleep in the night, you will not get sleep. Yes, all those problems are there, role conflict, lack of social support from the other people, lack of participation. Most of the time, nurses are not involved in decision making. Okay, decisions are made for nurses, but in that team, if you see, there is no nurse sitting over there. Okay, a group of doctors or other people not related to nursing will sit and take decision relating to your work. So that is again a problem. Lack of group cohesiveness. You don't have that much of cooperation within our own community. That is one reason. Poor working condition. Okay, so have you seen nurses station in the hospital? Have you all seen nurses station? Is it the best place in the hospital? It will be somewhere in the topmost floor along with lots of pipes. Some waste materials will be dumped somewhere, and in between they will give you a space with one cupboard telling that it is the place for you to change your dress. Okay, not nurses station isn't there in every ward. I am telling you some rest areas or anything like that, it will be mostly provided in the remote areas. Okay, so all those things are poor and no one is bothered about, like previous speakers were telling about handing over and taking over. Like 8 to 2 is your duty hour. Okay, so you have to punch before 8 o'clock. Nowadays everywhere punching system is there. Is any management bothered about whether my nurse is punching back at 2 o'clock? Is anyone bothered? Yes? So you are giving handing over, taking over in your own extra time. And example, when you are working in an intensive care unit, most of the time I have experienced during the handover time, my patient may collapse. And then your handing over stops there. You have to revive the patient, and then once the patient is okay, then only your handing over continues. I don't know how many nurses are there who have actually been into that point, then only you will understand. And sometimes, if your patient dies during your handover time, the next nurse will not take care of your patient from your hand. You have to complete all the formalities, close the bill, hand over the body to the relatives or to the mortuary, then only you can go. So what is happening? It is our poor working. No one will consider. Next day can I come back at 8:30 and make a punching? My salary will be reduced. Got it? So these are all some of the practical issues what we face, and then various organizational changes are there. Interpersonal and intergroup conflict is also there. Okay, so what are the causes of stress in nursing? Directly it is your job design, workload, interpersonal relationship with patients and their families. It is really stressful nowadays, especially when you work in corporate hospitals. Relatives demand so much of information from you. Okay, one patient is sick, you have to give them the information, not to one relative. 10% will come, ask you the same questions, and you should, with the smiling face, you should explain the same thing to all 10 relatives. Got it? Yes? So we cannot show our anger to anyone. So that is all a problem. Like all the other things I have already told, technical aspects are missing. Dealing with death, dying and ambiguity. Yes, so nursing is not a happy job. Okay, where can you expect happy patients in the hospital? Do we have any happy patients in the hospital? Yes. Do you have anyone who is happy in the hospital? One area it is there. No one has done your OBG yet. Antenatal mothers, are they not happy? Maybe they are in labor pain. After that, at least postnatal ward will be somewhat happy ward. Other than that, all other areas in the hospital, they are with unhappiness. And we are there to take care of them. So that impact will be on the nursing person. We have to act as a reservoir of all that stress of our patient, their family members. We have to accept it. Okay? So we cannot show our long face. You cannot tell I am busy, I will come, I will talk to you afterwards. Nothing works, right? So that is there. And then RN shortage is there, nursing shortage is there a problem, and other things like that. Okay? So this is what is the expected one. Like in operating room, 1:1. Okay, one patient, one nurse. So these are all, I'm not going to read it in detail. So each area there is prescribed number of nurse and patient ratio. But most of the hospitals, this ratio we are not maintaining. That is what is leading to stress. If this ratio is maintained properly, then automatically our nurses will be able to render happy care to our patients. But when we are overloaded, then automatically we cannot smile. Okay, so that is the thing you should know. And this is like different countries with density. Like for every 1,000 inhabitants of the population in Germany, the number of nurses are 12.9%. So see, where is India? Where is India? Is it in the top or in the bottom? Yes, it is there down. So for every 10,000 inhabitants or the patients, we have only 1.5 nurse. So we are very, very less. That is the main reason for nursing shortage and burnout. Okay, so just a statistics for you, and types of stress you have already discussed. Previous speakers I am skipping. So ma'am has already described what is eustress. Eustress is a normal stress which we should have. If we don't have that stress, we will not get up. We will just try to sleep only. Okay, if there is an attendance at 8 o'clock in college or in the clinical area, will you get up in the morning? Yes, will you get up? You will be worried. The teacher will be standing there to take attendance. So for her reason, you will be jumping and running out. So that is eustress. And distress is which is going to cause you harm. So there is a narrow line in between. So you should know, am I in eustress or am I moving into distress? So that line you should be able to identify. So when you move from that to here, this is where you end up with lots of diseases. So you should be able to understand it properly. Okay, I'm skipping all these things. These are all some of the signs and symptoms. It affects your behavior, that is your sleep is affected, eating habits are affected. You will not be able to take a decision. Good decision making you will not be able to do if you are in stress. You may end up with you will not have motivation. You may be aggressive. Okay, you will be nowadays the major complaint from the patient is, my nurse is not smiling. My nurse is not talking. These are the major complaints which we receive from corporate hospital. Why? Why nurse is not smiling? Because we are overloaded. Yes, we are taking care of extra patient load and we lack support. So that is why we are having all those problems. So nervous habits, all those there. And in body, you may have palpitations, you may have headaches, skin condition, high blood pressure, digestive problem, muscle tension, all those things are problems in the body. In emotion, you may become short-tempered, you may have fear, you may be fearful, anxiety, low mood and depression. Like in the hospital, you will take care of your patient beautifully. When you go home, you show all your anger on your kids, on your parents, husband, whoever is available, done. Because you have been kind and compassionate to the patient in the morning and evening you are aggressive. Why? That is displacement. Yes, your entire anger you are showing it on poor children. And child will be looking at you, why this mother is shouting at me, I didn't do any mistake. So what is happening, what is inbuilt, what I have taken up, I am taking it out into my family. So that is there. And in the thoughts, you may end up with negative thoughts, feeling of injustice, hopelessness and confusion. Okay, I'm just skipping this. Yeah. Okay, so does this stress in the workplace have an impact on the work area? Do you impact something in the patient care? Yes, you will get job dissatisfaction. You may have turnover, nurses keep moving. Because of the extra stress and burnout, over a period of time they feel, no, I cannot carry on with this. So I'll stop and I'll move to another. And many nurses are quitting nursing profession all over the world. Yes, even after COVID, our demand has increased because in foreign countries, many nurses have stopped nursing profession and they are trying to go to some other profession. Okay, so these are all the things. Reduced efficacy is there. Sometimes we get ill. Absenteeism can occur. Sometimes you can end up with alcoholism. Petty internal politics can be there. And bad or snap decision, you will not end up with correct, because in nursing, our decision making is very, very important. What next to do for my patient? Okay, his heart rate is dropping. His output is dropping. What next? So we should be on toes. What next to be done? So when you are not in a good mood, when you are stressed, your decision may go wrong. Okay? Yes. So these are all some of the things. Okay. So it is not the stress that kills you, it is our reaction to it. Do you understand this? This is not my last slide. I have some more to go through. So stress is not the one which is killing you. It is how you react to stress. Right? Okay. Now a question to you. There are 2 nurses, 2 patients here. 5 more minutes, please. Which nurse or whom do you support, A or B? Imagine your father is there in the hospital. Which type of nurse you want to take care? A or B? B. Yes, all of us like B. Yes, because he is happy and his patient is also happy. Here he is angry, he is demanding something on the patient and the patient is not happy, he is in an uncomfortable position. Okay, so all of us like happy nurses, we don't like stressed nurses, okay, who are really angry to do the next thing. So how can we manage the stress? First thing is you should understand, am I stressed? You should note your clues. Okay, you will have lots of aches, sore shoulders will be there, strained back, low back pain will be there, hazardous substance exposure will be there, and then sensory overload. Okay, like if you are in intensive care units or anything like that, no, monitor, sound and all will be there, which will be causing you lots of overload. So do you have any of these things? You should be noting it. And then you have to take up the tips. Tips for stress management is tackling the problem, try to tackle the problem, avoid stress whenever it is possible, do exercise every day, eat well, have some hobbies, free time, leisure time activities you have to develop, whichever you are comfortable with. Try to do meditation and relaxation, go for a vacation whenever it is possible, and every day try to sleep well, right? So first thing on stress management is awareness. You have to put a torch into your brain and ask, am I stressed? So first thing is you should be aware of your stress condition, then you should try to relax yourself, meditation, try to talk with someone. Okay, maybe your friends from other discipline, maybe your parents, siblings, whomever you are comfortable, you can do. You can go with various problem solving methods you can try. If you have pets at home, try to spend some time. So various researchers have proved that playing with pets or playing with small kids, maybe in your house or in your neighborhood, can reduce your stress. Okay, listen to your music. Okay, so I'm just skipping this. So already other speakers have told about deep breathing. So whatever is possible, don't tell, I don't have time. Okay, so once you are sick and you are getting admitted, you cannot tell that you don't have time. So try to do something for your health. Okay? Yeah, and already other speaker has expressed this about this. Alter the situation if it is possible. Avoid unnecessary stress. Adapt to the situation. Here in adaptation is, I am a nurse. I have to take care of sick patient. Yes, so I cannot expect like next year I will get a set of happy patients. That is not going to happen. So we have to adapt and then we have to accept it, right? And this already has been discussed. And the major area where we get stressed is time management. Okay, so we should learn. And in future, like we may all be, have you all heard about skating? Yes, maybe in future, in our curriculum, skating will become an part of our curriculum. Like only a nurse who knows to skate will be employed in an organization because that much of work in that much of hurry I am supposed to do. Yes? So they don't consider you as a human being, they want their task to be completed. Okay, so maybe in future this will be instead of our normal shoes, we may be in skating shoes. Okay, so like main problem in nursing to create stresses, time management. So make sure you prioritize your task, what I should do, what I can do first, what I should do second. So that prioritization is very, very important. Cluster the care component. If you are going to a patient, complete all the care, whatever is needed for him. Don't keep walking up and down and waste your time. This is for nurses working in the ward. So if you go to a last room, you have an injection, you have a tablet, you have some prescription to give him, do everything at a stretch so that you can save your time. So that can be done. Act proactively and address the potential problems, what can come, and use effective organizational strategies. Okay, you should know next to whom I should report. If something is going wrong, to whom is the next person I can call for help. Yes, so all those things you should know. Like be diligent about taking breaks. So in case you have 5 to 10 minutes of break time, please make use of it. Okay, go take some fresh breath. Yes, then you can take sip some coffee or tea, come back and then do. Okay, don't try to save that 5 minutes break and give patient care. So that is going to make you sick. And use technology efficiently whenever possible and seek assistance from key team members. If you feel that it is too much for me, inform that to your supervisor. One of my patient in the ICU is critical. Yes, so I cannot care for the next patient. Like in ICU, they used to give us 2 patients. One will be on ventilator, another one will be little bit okay patient. But suddenly when one patient, what? He goes into an arrest or he gets its condition deteriorates, then you will not be able to care for the second patient. So then you have to seek assistance from the other team members, okay? And then perform rounding, okay. Yes, last 2 more slides please. So, future nurses, it is for you to take care of your health, we are stressing so much, okay? So every time when you are stressed, your cortisol level increases, okay? So whenever we are in stress, our level of cortisol increases, and that will damage all the vital organs. It will affect your heart, it will cause high blood pressure, your sugar will shoot up, your digestive system will be disturbed, you will have nerve problem, you will have anxiety, depression, headache. Yes? So, like stress is a part of life, so we cannot stop stress, but what we can do, instead of that, we can go with happy hormones. Okay, so these are the four: dopamine, oxytocin, serotonin, endorphin. These are the happy hormones. So by doing various things like doing something which is rewarding, you will secrete more dopamine. Yeah. Okay, then you can go back and browse about the happy hormones since I'm running short of time. So one thing I would like to tell is, you cannot reduce cortisol because nursing is a stressful job. So what you can do instead, you can try ways to improve your happy hormones, happy chemicals in your body, so that the stress gets washed out and you will not end up with health problems, right? And various studies, researches have been done. Nurses are in stress, nurses are in stress. Okay, many studies are there. I'm not going to go in detail, but even though studies are done, no remedial measures are taken to control that. Okay, so that is it. And I don't know how many of you have traveled along with the patient in the ambulance. Have any one of you accompanied patient in the ambulance? Yes, no? No, yes. Only you, no one else. Only you and your patient. Your heart rate, I have done it. Okay, many a times I have done it. So during that time, your heart rate will be more than the ambulance siren. You can hear your heart rate more than that. To that extent, your heart rate will increase. Okay, so that is an emergency. When you shift the patient, when you do all those things, your cortisol levels are increasing. So my dear nurses, what you have to do, you have to go back and try to create more happy hormones in you so that the stress effects are washed out. So stop stressing and start living. Thank you. Thank you for the opportunity.
Thank you, ma'am. Thank you for completing your toughest task given by sir at the last position as a motivational speaker. As I know you people have lost your patience. Do you have a patience for one more speech? Sure? Do you have a patience? एक और कर लें? Okay. I know you have lost your patience. I would like to call Dr. Akhilesh Sharma sir for taking feedback from you people.
Good evening, all of you. You person lost your patience. Lost your patience. Patience तो कभी खत्म नहीं होना चाहिए. इतनी जल्दी यदि पेशेंस लॉस हो जाएगा तो जीवन में क्या सीख पाओगे दोस्तों? एक चींटी को देखा है? एक चींटी को, उस चींटी के आगे उंगली लगाना, फिर वो चींटी अपना रास्ता बदल देती है, फिर आगे उंगली लगाना, फिर वो रास्ता बदल देगी. जितनी बार तुम उंगली लगाओगे वो पेशेंस के साथ अपना रास्ता बदल देती है और गोल को अचीव कर लेती है. तो ऐसे गोल ओरिएंटेड होना चाहिए और पेशेंस के साथ रहना चाहिए. आज का सेशन बहुत बढ़िया सेशन रहा. आप लोगों में से मोस्टली जितने भी लोग हैं, शायद यहाँ का तो एक ही क्लास है, बाकी के सब बाहर के कॉलेजेस के हैं. और सुनना चाहते हो नहीं सुनना चाहते हो बच्चों? तो कीप साइलेंस प्लीज, अदरवाइज आई विल फिनिश विद इन 2 minutes एंड आई विल गो बैक. आज का सेशन बहुत बढ़िया रहा. टॉपिक सिलेक्शन बहुत बढ़िया था. स्ट्रेस एंड मैनेजमेंट, इसकी बहुत जरूरत है हमारी यंग जनरेशंस को, कि कैसे प्रॉब्लम्स को सॉल्व किया जाता है और कैसे प्रॉब्लम से बिन पाया जाता है. आपकी कॉलेज के बच्चे तो बहुत कम हैं, आज शायद दूसरी कॉलेज के बच्चे बहुत ज्यादा हैं. और आज मेरे हिसाब से शायद पहली बार यहाँ कॉन्फ्रेंस ऑर्गेनाइज हुआ इस सिटी के अंदर. उन्हीं पहले लखनऊ, नोएडा, बनारस यहाँ कॉन्फ्रेंस ऑर्गेनाइज हो जाता होता था, और आज आपकी कॉलेज में कॉन्फ्रेंस ऑर्गेनाइज हुई है, जिसके लिए सबसे ज्यादा श्रेष्ठ तो आपके मैनेजमेंट को जाना चाहिए, जिनके जो मैन आपके करता धरता हैं, जो आपके मैनेजमेंट डॉक्टर अशोक सिंह सर, उसके अलावा आपके ट्रस्टी मैडम, आपके चेयरमैन सर और ट्रस्टी मैडम, जिनके बिना कोई काम पूरा नहीं हो पाता, जिनका मार्गदर्शन और सपोर्ट हर प्रोग्राम को, हर चीज को पूरा करने के लिए कॉलेज को जरूरत होती है। उसके अलावा उनके बाद में आते हैं आपके प्रिंसिपल सर, जिनके कारण आज हम सब लोग यहाँ आए हुए हैं, कोई कहीं से कोई कहीं से, और ये प्रोग्राम सक्सेस हुआ। और सबसे बड़ी बात तो कॉन्फ्रेंसेज आपने बहुत बार अटेंड भी किया होगा, नहीं किया होगा, यूपी स्टेट मेडिकल फैकल्टी से जो 2 आवर्स इन्होंने अचीव किया है, वो एक बहुत हार्ड वर्क के बाद 2 आवर्स अचीव होता है। ऐसे ही 2 आवर्स अचीव नहीं होता, उसके लिए कितने चक्कर और कितनी मेहनत करनी पड़ती है, वो सारी चीजें हैं। और बाकी आज का प्रोग्राम में आपका फूड एवरीथिंग इज गुड। अब आप बताइए आपकी तरफ से क्या फीडबैक है आज? ऐसी कॉन्फ्रेंस ऑर्गेनाइज होनी चाहिए, आगे नहीं होनी चाहिए? आपकी कॉलेज की तरह ऑर्गेनाइज होनी चाहिए, नहीं होनी चाहिए? अब आपके पास कोई क्वेश्चन रिलेटेड टू योर प्रॉब्लम, यू कैन आस्क मी एनीथिंग। मैंने आपको बोला था ना बेटा, एक प्रॉब्लम्स लीड विन, एक वर्ड आता है प्रॉब्लम्स लीड विन। परेशानियों के बाद ही इंसान जीतता है। इंसान के जीवन में यदि परेशानियां खत्म कर दी जाए तो उसे जीता हुआ नहीं बोलते। जितनी परेशानियां, जितनी आपके पास मुसीबत है, जितनी आपको ठोकर लगे, आप सोचिए कोई ऊपर वाला तुमसे कुछ और बड़ा करवाने जा रहा है। और कुछ पूछना है आपको? कई अभी एक स्टूडेंट मिले थे, बोल रहे थे सर फर्स्ट ईयर में हमारा सप्ली आया, सेकेंड ईयर में सप्ली आया। बेटा सप्लीमेंट इज द डिजिट ऑफ मार्क्स। आप पढ़ लीजिए, पास कर लीजिए, लेकिन उस चीज से सीखो ये कि आपको दोबारा सप्ली नहीं आना पड़े, और आप उस पेपर में इतनी अच्छी मेहनत करो कि दोबारा आपको सप्ली के मार्क्स अचीव ना करना पड़े। और कोई क्वेरी आपके पास? ओके, फिनिश इट। थैंक यू सो मच फॉर आवर मैनेजिंग ट्रस्टी एंड चेयरमैन सर एंड आवर वाइस प्रिंसिपल एंड प्रिंसिपल मैडम, प्रिंसिपल सर, थैंक यू सो मच ऑल ऑफ यू।
Thank you, sir. Thank you so much, sir, for motivating our student again. Students, how you enjoyed this session? Have you enjoyed this session? कुछ सीखने को मिला? दोबारा कर ले एक बार। एक घंटा और एक्सटेंड कर ले। Sure? Okay. I think you people have enjoyed our today's session. So now we are going to end up with the session. End करने से पहले कुछ सुनना चाहेंगे? पक्का? ठीक है, फिर ध्यान से सुनिएगा। काश फिर मिलने की वजह मिल जाए, ठीक है? काश फिर मिलने की वजह मिल जाए, साथ जितना भी बिताए वो पल मिल जाए, चलो फिर आंखें बंद कर लो, क्या पता ख्वाबों में गुजरा हुआ भी कल मिल जाए। I don't know when we are going to get together again. I am very thankful to all the dignitaries, chairman sir, trustee ma'am sir, and you all people as we are gathered today, right? I don't know when we are going to be gathered tomorrow, right? Okay, so now you are going to end this session. For ending up this session, I would like to call Director Sir and Trustee Beena Ma'am to give a memento and certificate to all the resource persons. Sir and Ma'am, please come. सर, मैं सर से चाहूंगी कि सर कुछ लाइनें बोलें आज के सेमिनार के लिए।
यहाँ बैठे हुए एमएसडीएम कॉलेज के प्राचार्य, डॉक्टर जिजिल भी, उप प्राचार्य रोजी मौली जी, यहाँ आए हुए स्ट्रेस मैनेजमेंट पर जो गेस्ट लेक्चर देने के लिए हमारे यहाँ लोग आए हुए हैं, सभी सम्मानित लेक्चरगण, विभिन्न विद्यालयों से आए हुए सभी छात्र और छात्राएं, बहुत ही अच्छा सेशन रहा। सुबह मैं थोड़ा आने में लेट हुआ, इसलिए प्रोग्राम अभी तक लेट हो गया, मुझको एहसास है, लेकिन क्या करूं, शहर में रहते हैं हम लोग और शहर में आ रहे थे, सड़क पर ही एक ट्रैक्टर फंसा हुआ था जिसके लिए पूरा जाम लगा हुआ था और जिसको फिर से हम लोग घूम करके और बाईपास से आने में हमारा कम से कम 35-40 मिनट अधिक लग गया। आज का जो सेमिनार हुआ है, इस सेमिनार के लिए मैं अपने विद्यालय परिवार को, प्रिंसिपल को, वाइस प्रिंसिपल को, श्वेता को और सारे टीचर्स को, जितने भी जिन लोगों ने मेहनत से किया है, प्रतीक हैं, अजीत हैं, जिन्होंने मेहनत करके इस कार्यक्रम को सफल बनाया है, और उन सारे बच्चों को जो आज आकर के इन सेमिनार में भाग लिए हैं, सबका मैं बहुत बहुत सबको बधाई देता हूं। और साथ ही साथ जो लोग गेस्ट लेक्चर जो आकर के अखिलेश जी हैं और तमाम हमारे यहाँ लोग आए हुए हैं, दिल्ली से अखिलेश जी आए हुए हैं, कानपुर से मैडम आई हुई है, SCPM गोंडा से आए हुए हैं, सासाराम से आई हुई है, ये तमाम जो हमारे आजमगढ़ से आई हुई हैं, ये तमाम जो लेक्चरर आए हुए हैं आकर के, जिन्होंने अपने विद्वतापूर्ण लेक्चर दिया और बताया कि स्ट्रेस मैनेजमेंट के कई कारण बताए। स्ट्रेस जब हो जाता है तो उसको कैसे मैनेज करना चाहिए। नर्सेस वार्ड में काम करती हैं, मरीजों को साथ काम करती हैं, तो उनको किस प्रकार से मरीजों के साथ काम करते हुए उनका भी स्ट्रेस दूर करना चाहिए और अपने भी स्ट्रेस में नहीं आना चाहिए। आज का जो स्ट्रेस है, जो तनाव है, आज वो घर घर पर परिलक्षित हो रहा है, व्यक्ति व्यक्ति पर परिलक्षित हो रहा है। आज दुनिया इतनी तेजी से भाग रही है कि आदमी उसके साथ दौड़ना चाहता है। और अभी जब सवेरे लेक्चर हो रहा था, उसमें बच्चों का जो उदाहरण आया, वो सबसे बड़ा ही, उसको मैं भी देखता हूँ कि छोटा सा बच्चा अब मोटा सा बैग कंधे पर लादे हुए, झुकी हुई कमर, और वो जाता है क्लास करने के लिए। आजकल जो अंग्रेजी स्कूलों की बाढ़ आ गई है, उन्होंने व्यक्ति का परिचय ही नहीं कराया और किताबों के बोझ से बच्चों को लाद दिया। हम लोग भी पढ़ते थे, क्योंकि मेरा एक गांव है और मैं यहाँ ही के प्राइमरी स्कूल में पढ़ा था, तो हम लोग एक पटरी और एक किताब छोटी सी और कखा गगा का और गुद्दी और चाक लेकर के जाते थे। यही स्कूल में तेजपुर में पढ़ते थे और आते थे। आने के बाद तुरंत हम लोग खेल कूद में लग जाते थे। फिर शाम को जो काम मिलता था उसको फिर कर करके और सवेरे लेके जाते थे। आज का बच्चा घर से जाता है, सवेरे उसको 5 बजे उठना पड़ता है, नहाता धोता है, 6 बजे उसका रिक्शा आ जाता है, उसकी माँ जब खाना बना के खिलाती है, स्कूल जाता है, स्कूल में जाकर के पढ़ता है, वहाँ पर टीचर का तनाव उसको झेलना पड़ता है। वहाँ से आता है तो पता लगा कि बहुत सारा होमवर्क लेके आ जाता है। तो इस प्रकार से बच्चे से लेकर बूढ़े तक सभी लोग तनाव में जिंदगी जी रहे हैं, और जो तनाव में नहीं जी रहा है वो सबसे सुखी है इस समय। उसके पास सुख का पैसा भले कम हो, लेकिन तनाव न हो, हंसती खुशती जिंदगी हो, तो उसका बहुत बड़ा एक अर्थ निकलता है। आज तमाम प्रकार के व्यवहारिक पक्षों को रखा लोगों ने, बच्चों ने बड़ा एंजॉय किया, और मुझे उम्मीद है कि ये लोग इन चीजों को सीख लेंगे और अपने जीवन में इसको डालेंगे। आने वाले समय में इसका सदुपयोग मिलेगा। इसके साथ ही साथ मैं सारे लोगों को बहुत बहुत बधाई देते हुए और आए हुए लोगों का आभार प्रदर्शित करते हुए वाणी को विराम दूंगा। जय हिंद, जय भारत।
Thank you, sir. Thank you for this vote of thanks. So I would like to call Dr. Akhilesh Sharma, sir, for receiving memento and certificate by our chairman, sir, and trustee Veena, ma'am. Audience, please give a huge round of applause. I'll request Razi ma'am also to please go and join. Next, I'd like to call Dr. Lisi Joseph ma'am. Dr. Lisi Joseph ma'am, please come for receiving memento and certificate. ऑडियंस आप रुक क्यों गए? आप ही तो सब कुछ है, आप ही रुक गए? Next, I'd like to call Professor Dr. S. Vijay Gurma, sir. ऑडियंस खाना डाइजेस्ट हो गया क्या? Next, I'd like to call Dr. Jasmine Manu, ma'am. Once more. Next, I'd like to call Dr. S.P. Nar, sir. Sorry, he went. Next, last, Professor S.P. Natha, ma'am. एक बार और कर लें? I'll request Principal, sir, to give a memento to their chairman, sir. Audience. Next, I'll request Razi ma'am to please give a memento to our trustee, Veena ma'am.
जनगण मन होगा
कॉलेज वाले बच्चे सर,
क्या?
कॉलेज वाले बच्चों को बुलाना है ये।
अच्छा, तो सबको थोड़ी बुलाएगा नहीं?
Last but not the least, we have not ended up with program. आपको भी तो सर्टिफिकेट देना है. So I would like to call one representative from each college. He or she will come and receive the certificate. Okay. First, Vedanta School of Nursing. One of the representative, please come. Anyone? Now you get the energy level as you are getting certificate. Okay. Next, LB College of Nursing. LB College of Nursing. Anyone please come? Any one of you can come. Next, Ma Kaushalya. Ma Kaushalya College of Nursing. Okay, I know you are happy as you are getting certificate. Now next college, Prakash Nursing College. Prakash Nursing College. Next is Avan Nursing College. Next is Lifeline Nursing College. Lifeline Nursing College. And the last is Sainik Nursing College. Sainik Nursing College. सैनिक से कोई नहीं है क्या? Thank you, sir. Thank you, ma'am, for your all contribution. Now we are going to end up with this session.